Hi, my name is Ben Young and I am a periodontist in San Antonio, Texas. Today I'd like to just talk about 3 phases of dentistry. If you're a patient, like I'm a patient, there are only 3 types of dentistry that we can have. The first one is emergency care. That's sort of like you need to go on an airliner, you need a seat and you need it today. Well, it's going to be tough because everything's booked up, flights are moving, and it's going to cost you a lot of money. Versus if you had 6 months to plan your trip, you can shop around and your fares will be lower. Everything can be managed as long as it's understood that it's out in the future and it can be planned for. So number 1, emergency care. Want to avoid that. Number 2 would be restorative care. Fixing teeth problems and getting them accomplished and treated as quickly as possible. Obviously that lowers cost, because if you wait because it doesn't hurt, for example, and it gets worse, then the cost is going up. So whether or not somebody's going to see a dentist or they're avoiding a dentist, the cost is going up if they really need the care and things are breaking down. Teeth can decay completely away in a year. I've seen it many times. So there are things that need to be addressed and addressed as quickly as they possibly can. That's the restorative phase. That's fixing somebody back into a level of health, stability. But then there is no way to keep somebody there with one treatment. In other words, there's no cure for dental problems. Somebody does something, they inject your arm with a medicine, and when you're 20 and you don't need anything till you're 80. That doesn't exist. Which brings up the third, and I consider the most important phase, and that is preventive care. Preventive care is trying to manage somebody in a state of health as long as is possible to do in a reasonable way, under normal control, reasonable costs. And it is the type of thing that can be managed and budgeted, but it just requires somebody to commit to saying, you know, I just need to be seen every year. It's my opinion that most periodontal disease occurs in people who have avoided dentistry for over 10 years, usually in their 20s. And because of that, they were busy in college and they were busy with children, and it wasn't until their children needed to see a dentist that they decided, well, maybe I should go have my teeth checked too. And that's when we see a lot of problems. But those things had been building for quite a while, usually. Not always, but usually. So that's all I wanted to talk about today, just the 3 types of care people can choose. Emergency care, you got to do it if you got to do it, but I would strongly recommend trying to avoid it by going into the other 2 phases of care. Get your teeth treated. A lot of those things can be managed over a period of time. They don't have to be instantly accomplished, but then stay on a preventive plan and do that year in and year out, and that's the way to really afford dentistry at the optimum. It's not like it doesn't cost anything, but we want to keep it as affordable as we possibly can. Therefore, preventive care is a must. Thanks for watching.